Okay, so one part of the pelvic floor that we tend to struggle with during pregnancy is the obturator internus muscle, which is a hip stabilizer muscle. It rotates our hip, but it also is part of the stability piece of our pelvic floor series of muscles. That pain can feel like very deep in the bum, or it can be like feel more internal, like inside the wall of the vagina too. So to get at that rotation, which also helps open up pelvic floor and is good for birth prep, we can do some internal rotation stretches. So I'm gonna show you a couple. One, we're gonna start reclined here, so holding ourselves up with our arms leaning back slightly, and then our heels are planted into the ground nice and wide. And then from here, we're going to drop the inside of our right knee into the ground, and then lift it back up, and then drop inside of the left knee, and feel that thigh bone, how it's rotating in its socket, here, and back up, other side, here, and back up. You should feel this like kind of deep in here, maybe a bit in the bum as well. It depends if like your hip is also tight. So that's option one, that's probably the easiest. Then option two is, we're gonna come into a wide kneel. I'd almost want my mat like this way. And then from here, toes are pointed out to the sides, okay? And then I'm gonna reach forward, so I'm on hands and knees. And then I might even from here wanna come down to forearms. And then all I'm doing here is rocking, bum back towards heels. Inhaling, exhaling. And visualize what your pelvic floor is doing in this position. Like you're creating a lot of really good space between sit bones, between tailbone and pubic bone as we rock back, okay? So that's option two, that's a frog pose, okay? Option three is to come into a 90-90 stretch. So say my right obturator internus was tight. I would come into 90-90 where my left leg is the one in front of my body with my foot flexed here, like this. And then my right leg is out to the side of my body here, with my knee at 90 degrees, my ankle at 90 degrees, okay? Like this. And then from here, I'm going to try and push myself out of that left butt cheek over into my right. And just by doing that, you should feel it a bit more in that right hip. Woo. And then from there, starting to lean forward through between the legs. So this way. Woo. And then from here, leaning forward. This is about as far as I can get. So no ego in this. You might also, depending on like how far along you are, the size of your belly, you might want to have your ball here and just be snuggling into that a little bit. Or you can try and lower yourself all the way down to the ground here. And just breathing, inhaling, and with each exhale, try to sink a little millimeter further into that side. And then you can always do other side as well. But those are three good internal rotation stretches to get into that pelvic floor, to get into that deep, deep achy hip pain that you can get